So we have a 70-year-old woman who presents to us with cough and congestion lasting for approximately 6 months. She's a non-smoker. She's a light drinker, drinks about 1 to 2 drinks per week. She has a history of Crohn's disease, which is currently managed by infliximab. She has a history of hypothyroidism and a history of osteoarthritis. Her physical exam was normal, her laboratory tests are normal, and her performance status is 2. She gets a chest X-ray, which shows a mass in the right upper lung. CT scan shows a 6 by 8 centimeter mass in the right upper lobe. There is no mediastinal adenopathy, but there are 2 lesions in the liver, one measuring 1.5 centimeters and a second one measuring 2 centimeters. Patient gets a bronchoscopy and biopsy of the mass shows large cell carcinoma. Molecular testing shows absence of major driver mutations. She gets a PD-L1 testing by immunohistochemistry, which shows her PD-L1 expression to be 2%. So a brain MRI shows no evidence of CNS disease. Therefore, our working diagnosis is patient have stage 4 or metastatic lung cancer. Patient was started on chemotherapy with carboplatin, paclitaxel, and bevacizumab. So in summary, we have a relatively healthy patient with comorbidities that will change our decision on what is the most appropriate therapy for this patient. What I'd like to concentrate on the fact that she has a history of Crohn's disease, and the Crohn's disease appears to be active because she's currently receiving treatment with infliximab. This patient has 2 lesions in the liver, but so far a PET scan has not been performed. And as we all know, there are other abnormalities in the liver that can be shown on a CT scan and does not necessarily represent a metastatic disease. So at the minimum, I would recommend doing a PET scan to confirm that those lesions are PET positive. If I would be the one picking the site of the biopsy, I would go for the liver biopsy because this is a procedure that can make a diagnosis and stage the patient at the same time. There are other abnormalities in the liver that can look like metastasis on a CT scan, notably a hyperplasia of the liver, and therefore I believe that we need to confirm that this patient truly has metastatic disease before we decide on treatment. So assuming PET scan shows increased uptake in the liver nodules, we confirm that this patient has a metastatic disease. What that means for us that this patient is not curable, but she's treatable, and the goal of treatment for her situation would be to improve survival and improve quality of life. Based on the fact that she was treated with carboplatin, paclitaxel, bevacizumab, I would quote her a 1% survival of about 50% and median survival of about 12.3 months.